all this if you want to get the word out there?
I'm more than okay with it. I'm
Okay.
very happy and honored.
Okay, great.
This is something that I really am passionate about, so
Okay, good.
I'll do this.
All right. What we'll do is go ahead and talk a little bit about Matt's situation. Matt has had the tics of Tourette's since he was age 2, he told us, and got to us at age
32.
32. Okay. So what we're dealing with here is we got an MRI of the jaw joints. It has already showed some degeneration of the jaw bones, and the radiologist reports that he cannot rule out medial and or lateral displacement of the articular discs. In general, when we see this happening, if the surgeon was to go in and look at these discs right now, there's going to be about 30 to 40% displacement on both sides, on both joints. This is very much the norm that we see in the surgical cases. We're going to start Matt off first, non-surgically. We're going to simply raise the appliance, the lower appliance, in order that we can take the pressure off the jaw bones. The secondary appliance is because his cranial bones are not level. That's the ALF, the ALF appliance. So if I may, I'll stand right behind Matt here and try to demonstrate. Get you straight there, sir. Okay, what I'm doing is palpating the sphenoid bone. There it is. And it is right about there, and as I think you can probably see, they're not very level. This is the sphenoid bone that goes behind the eyes. And behind the ears is the mastoid bone, and I'm right there on the tip of the mastoid on the top part of it, and the left mastoid is elevated quite a bit. When the mastoid bone is not level, the glenoid fossa, the sockets, the joints are not level. Therefore the jawbones are going up into uneven sockets. This is what we see happening in Tourette's cases, is that the jaw bones are going into uneven sockets, putting pressure through the disc onto the auriculotemporal nerve, and that sends noxious input to the brain, causing the tics. In addition, we have some issues going on with ADD, OCD. Using the ALF technology, we're able to, with all good luck over time, level out the cranial bones, which would reduce intracranial pressure. And again, with all good luck, that will unwind some of the symptoms of OCD, ADD, and all that are associated. Now, we also noticed Matt has the, I noticed his right arm, right hand does a lot of twitching too, and shoulders. That's all tied into these inputs going into the brain. We'll be addressing these over the course of time. We'll turn off for a minute. Very informal experiment to see if we take the pressure off the jaw bones, can we reduce the urges to tic? Hey Matt, open sir. Put it back in there, bite, hold. Okay, and then you can almost sense or see, there's almost like an instant calming effect that goes on. The jawbone is no longer jammed in to the base of the skull, it's down here now. That causes the pressure on the disc to be alleviated. Now this will take quite a few months to start unwinding all these issues, all these problems, but this is the concept that we do to just see if we're perhaps on the right path. And as you can see with Matt, we simply have a very calm guy here. Now, what will happen is as the discs start to move around, as they're allowed to unwind, so to speak, other symptoms may crop up for a while, and then we just simply raise the appliance more, get more vertical, and that should alleviate some further symptoms. But right now, this is a good start. Okay, let's take this away, sir. Good, thank you. And as you can see, immediately, the whole body tics come back. Thank you.